Good afternoon. Well, last week, the Commission for Gender Equality released a press release saying it believed there should be a lot of caution around implementing a policy of mandatory vaccinations. It said it believed there was a scientific study suggesting that COVID-19 could affect a woman's menstrual cycle. Then, on Monday, the South African Society of Obstetricians and Gynecologists released a statement saying that the Gender Commission had not properly understood the research that is available, and that they had chosen to ignore the benefits of vaccination. Then on Monday night, there was another development in this. The Health Department said the Gender Commission had not consulted any of the expert institutions and that its statement was not supported by data. One of the people who's now responding to the Gender Commission is Professor Helen Rees, Chair of the South African Health Products Regulatory Authority. Professor Rees, good afternoon to you, and thank you very much indeed for your time. I do appreciate it. What does the science tell us about the impact of COVID-19 vaccines on menstrual cycles?
Well, the science tells us, and it's not just one study, that in some women there can be a small increase in the length of the menstrual cycle, less than a day, and that in vast majority of women this goes back to normal in the next cycle. And we must compare that against what has been reported in some studies for women who have COVID infection, where in some studies up to 25% and more of women report abnormalities in their menstrual cycle. But the conclusion of all the experts looking at this slight prolongation in menstrual cycle in some women is that it is of no significance in terms of a woman's reproductive health. It has no impact on fertility. There has been no report, and we've looked very carefully at this, any changes of fertility. Vaccinated women are just as likely to get pregnant as unvaccinated women. That's been shown in trials, but also shown in clinics where they're doing assisted fertilization with women. No difference whether you're vaccinated or unvaccinated. So there is no impact on fertility. And I think the real worry, and this was very well said by Saphra, was that the benefit of immunizing women in reproductive age is huge once they become pregnant. Because one of our real concerns is that what we have seen with a number of the variants of COVID is that when women who become pregnant and become infected with COVID have a higher mortality, more women die, they have higher risk of preterm babies, which in itself can cause problems for the babies, and a higher risk of going into intensive care units and so on. So the risk in pregnancy if you get COVID is greater than a non-pregnant woman. So there are many, many good reasons to really be strongly recommending that women in this age group become vaccinated.
Does this apply to all the vaccines that we have? We have the Pfizer vaccine, Johnson & Johnson, Sinovac, there are others. Does it apply to all the vaccines? Have there been studies on all the vaccines on this issue?
It's a very good question. So the way that we monitor vaccine safety isn't just at a country-by-country level or a vaccine-by-vaccine. There's a huge global effort to monitor vaccine safety. And if you think about it, it's important we do it. It's a brand new virus, and these are brand new vaccines. Even if some of the vaccines, what we call the platform, the core of the type of vaccine has been used before, but not for COVID. This is new. So globally, what we do is that we monitor side effects. And there are side effects that you will know about, common side effects. Some people report sore arms, feeling tired, myalgia, muscle aches. Those are the common ones. We know about these. But we're also trying to track worldwide whether there are any very rare side effects that if you get global data together, you will see what the impact is. So for all the vaccines, there is a global effort to look very carefully at whether there are any side effects, including side effects in relation to women's reproductive health. So at the moment, the guidance is clear for the vaccines that we have available that we are recommending them for women of reproductive age, that all of the vaccines that are available, that are recognized by WHO, recognized by Saphra, and many of the vaccines at the moment that are on the market, in fact, all of them that are on the market can be used in pregnant women. But we will look at that data very specifically on a vaccine-by-vaccine basis. Is it safe in pregnant women? That is being looked at specifically for vaccines and on a vaccine-by-vaccine basis.
I mean, Professor Rees, you'll know the argument that comes then, and this particularly as soon as people start talking about mandatory vaccinations, this argument comes up. How can we be so sure that the vaccines are safe when we've only used them for less than 2 years?
Well, we're talking about fertility. I think particularly these are the things that we know women have said we worry about. Fertility, do they impact fertility? And secondly, are they safe to use in pregnancy? And as I say, we've now got data not only from the clinical trials, which if you recall for all these vaccines have had tens, 20,000, 40,000 and more people participating. But for many of these vaccines now that are available, they've been rolled out to millions and millions of people, including many, many women in this reproductive age group. And as I say, the monitoring of safety of these vaccines for those particular issues has been very rigorously looked at, and including here in South Africa. And at the moment, we haven't seen any vaccines that impact on fertility, and this is looking across the world with all of the reports. And for the vaccines many of the vaccines that have been looked at, we're also able to say that they're safe in pregnancy. But as I say, that question we're very particular about for obvious reasons, and we do ask vaccine manufacturers and WHO and the COVAX facility who talk to the manufacturers in the process as they develop vaccines. We say to them, can you give us data on safety in pregnant women? It's one of the critical questions that we do ask.
All of this comes back to the issue around mandatory vaccinations, and in fact there's a case that people are talking about today from the CCMA. They allowed a company to let go an employee because she refused to get vaccinated. Do you as Saphra have a view on that, or as Professor Helen Rees, do you have a view on whether vaccination should be mandatory, or is that something that you'll leave to government?
Well, from the Saphra point of view, Saphra focuses on safety, quality and efficacy and in the public interest. So Saphra wouldn't go as far. That is a policy question. That would be a question that would belong to the Minister of Health, to the Cabinet, and so on. So Saphra's role is not that. We have to be able to say to the Minister and to say to the Cabinet and to the people of the country, if we license or give permission for a vaccine to be used, that we can have a certainty that this is going to be effective and that we understand the safety parameters, and we can let you know about those safety parameters and monitor on an ongoing basis the safety. So we don't look at mandatory vaccination. But if you ask me personally what I think about it, I think that there is a strong case to be made, particularly in certain areas of work, for example, amongst healthcare workers, who are highly exposed, who have been in the past when the waves hit, highly exposed to COVID. It protects them and their families, but it also stops them bringing infections into where they are working. And very often, many of the patients that people are dealing with are vulnerable. They have these comorbidities. So I would support mandatory vaccination. Obviously, there will be some few exceptions, but we have many people in this country who remain vulnerable with comorbidities, who might have what we call immunosuppression, whose immune systems might not be working as well, who make them vulnerable, and many of the common chronic diseases. And many of these people we haven't yet reached to be vaccinated. So we want to protect populations, and this is where in the Constitution you have to balance the rights of the individual to the rights of the good of the population. And it was on that basis, I understand, that CCMA ruling was made, that the rights of all of your colleagues in the workplace have to be taken